Let's look at a case study and work through it to figure out what decisions of care would we make for the patient. Meet the patient. George Thomas is a 52-year-old Caucasian male who works as a construction foreman. He has recently gotten checked for his blood pressure, which was 184/98 millimeters. It is very important to provide teaching on lifestyle changes for George, such as the use of tobacco. George is a cigarette smoker, so it's beneficial to let him know that the use of tobacco products is linked with increased risk of cardiovascular disease. An alternative of smoking would be nicotine gum. Since George works in the field, he is constantly stressed. For the management of stress, the nurse could share that relation therapy or guided imagery may be helpful to decrease blood pressure. George also drinks a lot of alcohol, which is also a risk factor for hypertension. So it's important to let him know to limit his drinking to about 24 ounces of beer a day and no more. The most effective way to experience success in these lifestyle modifications is to create a quit plan. The key is to encourage George to make a quit plan, which includes quit date, notifying friends and family of it, anticipating withdrawal symptoms, and throwing away anything that harms his health and raises his blood pressure. The best way to care for a patient is to teach them what to do and what not to do. The nurse will also provide teaching on limiting his salt intake and encourage him to start a weight loss program, as well as teaching on when and how to monitor blood pressure at home. Starting out with the medications, George will be prescribed chlorothiazide, which is a thiazide diuretic and initial therapy for hypertension. He will have to take this early in the day so it doesn't disturb his sleep, as well as atenolol, which is a beta blocker, and the nurse will let him know that the common side effects that he may experience is impotence. For both these medications, he must avoid drinking alcohol, which can increase the chance of dizziness. The nurse will provide teaching on adverse effects, the use and action, which are already mentioned earlier in the video, of both the antihypertensive medications for George, while keeping in mind the contradictions and precautions. Electrocardiogram will be also done to figure out if there are any underlying causes or complications that are making George's blood pressure rise. Assessments such as frequent neurological checks, including level of consciousness, pupil size and reaction, movement of extremities, and reaction to stimuli help detect any changes in the patient's condition. Cardiac, pulmonary, and renal systems will also be monitored for decomposition caused by severe elevation of the blood pressure, example pulmonary edema, heart failure, angina, or even renal failure. After teaching George about lifestyle changes and providing medication to reduce his blood pressure, it is necessary to set up another appointment to do a follow-up measurement of his blood pressure. Next time he comes, he will be on antihypertensive medications that were prescribed, but some clients still experience hypertension, so it's important to do a follow-up evaluation. If by the next visit the condition gets worse, there will be additional tests performed, such as ambulatory blood monitoring, as well as serum electrolytes and blood glucose. The nurse will also reassess the systems.